Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. So we are discussing about treatment of spastic cerebral palsy. We have completed almost all the parts and this is the last part. Okay. So suppose patient of cerebral palsy come to you and you are admitting that patient, then what will be your treatment plan? So this is what we practice. First we will admit the patient in the ward for 15 days of treatment. So we will have one treatment protocol, that is Abhyanga. So Abhyanga will be done. It is again case specific. It may be Kshiravara Taila, Prasarana Taila, depending upon the case and presentation of the patient. Then we will go for Agni Lepa, that is Agni Chikesa. Then we will go for Svedana. You can select any type of Svedana, SSPS or maybe Nadi Sveda, Potali Sveda, Upanaha Sveda, anything. Then we'll go for Shiro Pichu. Shiro Pichu or Shiro Lepa with the neurotransmitter enhancing drugs, as I explained earlier. Then we will go for daily Shirapaka. Shirapaka contains the different drugs like Medhya drugs, Balya drugs, and neuron degenerating quality drugs. Jivaniyagana, Balya, Vayastapana, Samnyastapana. All the drugs we will take together and then we mix together it, and then 1 teaspoon is taken from that and prepared Kshirapaka. And this has to be given daily twice. Then we can also go for daily Patta Bandhana if spastic cerebral palsy is there. And one of the benefit of Patta Bandhana is we can apply the Svedana for a longer duration. But before Patta Bandhana, it is always better to apply some oil so that there is no any skin manifestations or reactions and all. Another is Basti, Matra Basti, daily Matra Basti, maybe with Bala Tela, Masha Tela, Brahmi Tela, or sometimes Kalyana Gagruta, depending upon the situations. Another is cerebral palsy patient will also have some problem related to the speech because the spasticity will be there in the tongue muscles also. So we will go for Jivha Pratisarana. We will go for Jivha Pratisarana, daily the Pratisarana of the Jivha by using Vacha, Pipali, Manjista and some other drugs, Yashtimadu, etc. drugs. That helps to improve the speech problem and also it decreases the spasticity of the tongue. Then another is we go for mild physiotherapy. We go for mild physiotherapy, that is exercises and ball pressing exercise, etc. And then other treatments. So this is actually the treatment plan along with some of the oral medications. Now, what is the take-home message in cerebral palsy? Now, don't forget that actually we are trying to treat a asadhya vyadhi. Okay, so actually this particular cerebral palsy like conditions when he is coming to you, you should have this fact in your mind that actually we are trying to treat a asadhya vyadhi. So giving 100% treatment is quite impossible. Okay, so that has to be kept in mind. Then whatever is happening in cerebral palsy, it is because of the central problem. This has to be understood. Don't focus your treatment only on the local problem. Child is having spasticity, you go on giving the treatment for spasticity only locally. No, this spasticity is actually happening because of central nervous system problem. So meantime, it is very important to improve the central nervous system problem also. You have to correct the central nervous system. You have to change the brain environment. Otherwise, the result is not there. Result will not be available. Okay. So don't forget, as for the contemporary science, they say that oligodendrocytes once damaged cannot be regenerated again. But there is no need to believe this as far as Ayurveda, because Ayurveda says that mamsam mamsena vardate, raktam raktena vardate. So if you are able to replenish the same thing or supplement the same thing which is present in the nature into the body, then it may be in the brain, it may be any part of the body, it is a regenerative. Okay. So, however, this point has to be kept in mind. Now, treatment should be directed to the brain. Repeatedly, I am telling, treatment should be directed to the brain, not locally, because motor programming and its inhibition is in the brain itself. It is not in the local area. Okay. So, chances of neuroplasticity, developing the neural circuits, neural synapses, okay, in the brain is maximum by using the Ayurvedic drugs before the age of 3 to 5 years, because we say that up to 5 years brain growth will be there. In the first 2 years, brain growth is very maximum. Okay, up to 5 years we have got a brain development slowly taking place. During that time, if you interfere with our drugs, then the result will be good. Then local improvement, whatever you got, that is transitory. So don't forget, you are treating a asadhya vyadhi again. So be clear and confirm before claiming anything. before claiming anything, we should be very clear and confirm, and we should also counsel the parents how much improvement you can provide, okay, how much is possible. So this has to be very clearly explained to the parents, because already we are treating Aswadi well. Now, better to acclimatize the patient for the home care if it is, as it requires a long-term requirement with a monthly follow. Okay, see these procedures, what I told, maybe Kshirapaka, Jiva Pratisarana, Basti, Svedana, Abhyanga, etc. It is not only it is not only for the 15 days. Okay, you have to do it daily. So daily patient coming to the hospital, it is quite impossible. So better to educate the parents regarding this, so that they daily they can perform this in their home, and monthly they can come for your follow-up. So that's the best thing. Earlier the patient comes, better will the recovery. That means earlier the patient comes means before the complete development of the brain. If the patient is approaching you, then the recovery is somewhat good. Somewhat good. When the later they come, after taking all the treatment, after going to all the other hospitals with a lot of thick file, when they come, it's quite difficult to manage. Now, associated mental retardation, cerebral palsy patient may be there with mental retardation, without mental retardation. It depends upon the area of the involvement. If it is pure spastic cerebral palsy without involvement of any intelligence aspect, child is mentally fine, then the result is good. If the child is having mental retardation along with this spasticity, then the results are not so encouraging, because what we are telling, the patient is not able to understand. But if child is not having mental retardation, so we can convey the things to the patients. Okay, so if there are many comorbidities are present, again the treatment is quite difficult. So these are all some of the take-home messages regarding the treatment of cerebral palsy. So with this I conclude. Thank you very much. This is a whole series of treatment of spastic cerebral palsy in Ayurveda. So don't forget to subscribe my channel, and also please give your valuable comments. Thank you very much.